Although COVID-19 has largely limited travel between countries, a new idea is being put into practice that will allow some more freedom of movement within certain regions. They're known as travel bubbles. Two or more countries, regional states, or provinces that have successfully curtailed the coronavirus can create a bubble. This allows people who live within the bubble to travel freely within its borders and not have to self-quarantine. Estonia, Latvia, and Lithuania created one in the Baltics. In Atlantic Canada, the provinces of New Brunswick, Nova Scotia, Prince Edward Island, and Newfoundland and Labrador have a bubble for its residents, which came into effect on July 3rd. Altogether, the Atlantic provinces have about 1,500 confirmed cases and about 68 deaths. Dr. Jennifer Russell is the Chief Medical Officer of Health for New Brunswick.
It's not uncommon for us to collaborate regionally like this, but I think from a comfort level with the numbers being what they are and the way that there's kind of a corridor from Ontario and Quebec, obviously the Quebec border with New Brunswick, we are the gatekeepers basically for PEI in Nova Scotia. So it made a lot of sense with respect to how things were going in the Atlantic provinces compared to Quebec and Ontario.
Australia and New Zealand had been considering a travel bubble as well. But in early July, New Zealand Prime Minister Jacinda Ardern said that the plan would be re-examined because of a new outbreak in the Australian state of Victoria. Meanwhile, Singapore and Malaysia are set to launch their travel bubble on August 10th. Dr. Russell says the response to the opening of the Atlantic Canada bubble has been positive, particularly because people don't have to repeatedly self-isolate when they travel from one area to another.
There's a sense of relief around, again, gaining that extra freedom. And again, we try to be cautiously optimistic about this because this pandemic is not going away and there will always be risk outside of our borders. And so the travel imported cases will continue to happen. We still have to be ready for that. And in the meantime, again, be vigilant about testing, be vigilant about wearing masks when you can't physically distance, really trying to do low risk activities, in terms of being outdoors and versus indoors. And then if you are going to be doing activities that are indoors and have larger numbers of people, then again, doing as much as you can to be cautious around those types of risks and keeping your number of close contacts low.